So I'm 3 days post-surgery, and it's also my third day in a row trying to get a hold of my surgeon because I was sent home from the hospital with no pain meds and no antibiotics, even though that was a big part of the discussion during my consultation. Because I'm a complex case, I also have ulcerative colitis, fibromyalgia, myalgic encephalomyelitis, and a bunch of other comorbid conditions that contribute to my daily pain levels and, nausea, vomiting, and blood, and just all this stuff. Also, my period decided to come 3 days early and make this even worse. Luckily, I've had my best friend to come over during the day to help take care of me, but I just don't understand why this keeps happening with me and doctors. Like, I call and I say, hey, I had surgery, I wasn't given anything, I woke up and the surgeon was gone. There was no discussion afterward, how did it go? Was there endometriosis? What about my ovaries and the cysts? What about my lymph node? There was nothing. He was just gone, and I was kind of left in the dark. I woke up in horrible pain. My teeth were chattering, because that's what happens when I get really bad pain. And they had already taken my IV out. So I'm crying and chattering and shaking and writhing. And they were like, uh-oh, you're in pain. And they had to put the IV back in my hand to give me hydromorphone. They had to give me 2 doses because one wasn't enough. I was crying. It was just really intense pain. The kind of pain that I go to the hospital for. The kind of pain that no one will help me manage. And it's just okay, but even before they rolled me in, the anesthesiologist talked to me, and he saw on my chart, oh, you have fibromyalgia, so let me know, what's your best medication to help you manage, because fibro patients have a way worse time after surgery. And so I told him, morphine doesn't touch my pain. When I go to the ER, they have to give me hydromorphone, which is, super strong. So he was like, don't worry, I got you. And then the anesthesiologist was also nice enough to ask, do you have a pain management doctor for this? I said, no, I did, but he was only able to give me Suboxone, which is rough, and then my insurance dropped him, so I don't even have him anymore. I've been managing my pain pretty much on my own with fucking supplements and shit, stuff I can buy myself. But I don't have actual adequate pain management. Anyway, I just do I have to file a grievance against every doctor? Why is my surgeon ghosting me now? My follow-up is in 2 weeks. So at the follow-up, I'm going to have to be hey, so what happened, bro? Why did you just bounce and leave me with nothing? I don't know. Am I asking too much? Am I really asking too much? Is it not abnormal to send a patient home from this kind of surgery with nothing when who is a complex case? Am I just being dramatic? I don't know.